into private healthcare. Why is that?
That's right. That's because it's more of a fact-finding mission, really, than an investigation. An investigation is where you really find contravention. So if two people get together in the house and they decide the price of bread, that's price fixing. You can investigate that and prosecute. But in healthcare, you can't really point to one particular firm which has contravened competition laws, but you see signs that there are problems. So you will see rising prices above inflation and so on. So it's like a commission of inquiry. You want to understand what leads to these high prices.
Many people use the phrase, we feel like we're being ripped off when they talk about the private healthcare sector. Tell me, could there be even the slightest possibility of wrongdoing in this particular industry, do you think?
I wouldn't so much call it a wrongdoing, but it's a market. It's probably a market that's not working. You know, a market where you have competition, it's supposed to discipline pricing and have impact on things like pricing and quality. But when you have lack of competition, you start having problems. Now, competition in a complex sector like healthcare is very difficult because you have funders, medical aid schemes, you have providers like your hospital groups, and you have your doctors. And as a consumer, really, it's very difficult to even compare prices between these various levels in the value chain of healthcare. So it's more understanding the complexity and from that drill into the particular factors that lead to price increases.
I tell you why I ask you if there's even the slightest chance of wrongdoing. Take the maternity ward, for example. Many women lamenting the fact that nowadays they're getting gynecologists who seem to be encouraging them to have C-sections because there are better financial spin-offs for them. So there's more money for them as opposed to natural delivery. So that's why I wanted to know from you, could there be some collusion going on? Could there be some sort of wrongdoing, as I said?
There's certainly been arguments made that there are wrong incentives, perverse incentives that drive people into driving patients towards particular procedures because they are going to earn better income if they do that. So we want to probe all of that because, as I say, it's very complex because how do you decide what is the best situation for you as a patient in your circumstances? I don't know that, but we have to investigate. Is there a relationship between the doctor, the gynecologist and the hospitals that perhaps could be driving some of these decisions?
We'll have to leave it there for time constraints, but we look forward to the findings of that market inquiry and be sure to come to us on the show and just give us some of the details of some of your findings. There we have it. That was the Acting Commissioner there of the Competition Commission, Thembinkosi Bonakele, just giving us a snapshot of the areas of focus for that market inquiry into the private healthcare sector.